Hi everyone. This is going to be a dissection of the lower rabbit circulatory system. Um, so there's not a whole lot of uh, cutting to be done. We're going to extend this incision that the company made to stay in the hepatic portal system. We're just going to extend that down and up. You'll notice that I have not done my upper circ. You'll have an incision that has actually started and gone that way, so you won't have to worry about extending this way on this day. But just I'll kind of show you that at the very least, and then when we get in there, we're gonna have to kind of separate out the organs that we'll go over in a walkthrough, and just you want to be careful of a few of them, and we'll get to those once we're actually inside. So I'll see you then. Okay, so you can see that opening it up is not that complicated. You do want to be careful of the gonadal artery and veins. In the male, they exit the abdominal wall into the and form the spermatic cord along with the vas deferens. So you do want to be careful of those when you're down here. And then up this way, you've already made this cut by this point. I just extended it a little ways up. I'm not going to focus too much on doing upper circ right now. But once we get inside, you can kind of take those intestines and the cecum and pull them over to the side to see a lot of the stuff that we want to see. And you'll notice that there's actually quite a bit of fat back here. We'll want to remove that. We'll want to pull one of these kidneys off of the abdominal wall and going to clear out that fat and fascia around it so that we can see the renal artery and vein and also the adrenal artery and vein, which are going to be going up this way. So I am going to do that. I'm just trying to think of things you want to be careful of. Do be careful of the pancreas. It doesn't look like much. It looks kind of like a piece of chewed up bubble gum. In this case, it's kind of yellowish. It might not be the same color in your rabbit, but yeah, again, the pancreas is very delicate, and there is one artery that we'd like to see, if possible, in there, the pancreaticoduodenal artery. But if it does get torn, that is totally okay. I believe it is just in theory for you. But yeah, the cranial pancreaticoduodenal. So that is in here. It goes to the pancreas and the duodenum. Go figure. All right. So I will see you while I'm clearing all this fascia. So see you in a little bit. Okay, so I'm messing around in this region, and I happen to pierce through the caudal vena cava. So just be aware that it seems, well, at least in mine, it forms a bit of a pocket in this area. It might be different in yours. In fact, it's most likely different in yours, given the variation that we see in the circulatory system of like all mammals at the very least. So just do be aware of that. You might punch through that caudal vena cava in this area, especially if it's forming a fairly large pocket. It might also be an artifact of the preservation process where it's totally filled with latex and just expanded. That venous system, so you can see up here, there's a great big caudal vena cava that is very full of that blue latex, and it's also it's got very, very thin walls, so do be careful of it. Another thing to be aware of when we're down here is the gonadal artery and vein. I've tried to be very careful with those. Here's one set. It looks like the vein is a little broken. Oh, actually, the vein is actually coming off the iliolumbar, or right near where that iliolumbar artery and vein branch off. So that's interesting. A little bit of variation. Usually they branch off a little bit higher. So if I clear this off, we'll be able to see that gonadal artery, which is branching off higher than this, than the caudal mesenteric artery, which is this right here. Keep track of where these arteries and veins are going, because that is going to tell you exactly what they are. So these ones, the artery and vein, are going to and from, respectively, the testes. They join up again with that vas deferens and go down this way toward the scrotum, where the testes are located. In your bunnies, they're fairly young for the most part. So if you have a male, the testes might not be descended, and you might see them just kind of peeking out right about here. Just be aware that it might not look exactly the same as what you see in mine with a fairly large adult male. And if you have a female rabbit, I think we will do a demo of this, but just in case we don't, the ovaries will be right around here, and then you'll find the uterus. There's a uterus on either side that extends down the wall, and it is attached to the wall via ligaments. And you want to, if possible, keep those ligaments in place. So you don't want to like go out and take all this fat away, which I have been doing. You just want to be very careful with that. If we can keep it in place, that's great. If it does come off the wall, it's okay. We generally will only ask the ligaments in theory. So like there's different ligaments for the uterus, for the fallopian tube, the oviduct, and the ovary itself. So keep those if possible, but if you can't, it's totally okay. What's left to do for this, ideally we'll be able to separate most of the small intestine and large intestine and the cecum. It takes a minute to do it. If we want to be like very vigorous about it, it doesn't take too long. I'm trying to be delicate to preserve as many of these mesenteric artery and veins as possible. But it is okay if a bunch of them come apart. I just want it to look nice. But anyway, I'm gonna keep going. I'm gonna go for the stomach, try to get all of the arteries around the stomach involved with it, and the spleen. And eventually we'll get down here. I'll show this as a close-up, like probably a photo, because it's very difficult to get a close-up of this region, and this one can be kind of confusing for students, so we do want to show that in detail. And then we'll get to the leg after that. So see you in a bit. Okay, I made a little bit of a mistake earlier. I said this is the pancreas. That is wrong. That is just fat covering the cranial pancreatico-duodenal artery. The pancreas is actually here. It's even more chewing gum-like than you might have previously thought. But it's basically just a bunch of like granules, and they produce insulin and among other hormones, I believe. And those are involved in digestion. So they're you see like all of that mesenteric artery and vein kind of interweaving with the pancreas and then going toward that duodenum, which is this first part of the small intestine. So just wanted to mention that that I kind of messed that up. But anyway, let's keep going. Okay, so we've uncovered basically everything we need to see within the abdominal cavity. I can clean it up some more, but I feel like, that's not the most exciting video to watch. So I want to get down to the leg, and there's a few things. Well, I kind of have to tear through some muscle, which I'm sure will be very exciting. So let's do that. There's only a few arteries and veins in the leg, but there's some that we have to dig a bit deep for, especially proximally. And then like this saphenous, we can see on the medial side without too much dissection. Then there's going to be the popliteal artery and vein, which are defined by the muscle they exit. So I'll show you that in a slightly different view when I get to that point. All right, let's do this. Okay, so you'll notice that there are a lot of smaller arteries and veins branching on the leg. We really only want you to know the major ones. So you got the femoral artery and vein. The deep femoral artery and vein is way up here, near where it exits the abdominal wall. You have a artery and vein that dive deep, or I guess come up from deep. So those are your deep femoral artery and vein, way up there. We do want you to uncover them. And then you get this major branching where we get the saphenous artery and vein, and then diving deep is the popliteal artery and vein that will then branch into the anterior and posterior tibial artery and vein. So I'm going to flip this over so we can see that dissection from the other side, caudal view of the rabbit. Okay, so now we're looking at a caudal view of the rabbit. So you'll notice a lot of arteries and veins branching off back here. As far as gluteal, you can see the gluteal artery, and well, mostly just the artery, really. If you dig kind of right up here, we just gotta lift this stuff out of the way. So this is the gluteal artery, at least part of it. It goes to the other muscles of the glutes. And here it is. So we can see that go through from within the abdominal cavity. It will take quite a bit of additional digging to find it, but it can be done. I may or may not show that in this video. We will see exactly how much time I have, but it can be done. So we will show you that in class as well. But the important part that we want to get to here is that popliteal artery and vein, and then the anterior and posterior tibial artery and vein. So we actually can see our posterior tibial artery and vein right here, and we follow that up, and I think, so we generally don't do this vein, even though it is beautifully filled and so incredibly clear. I actually am not sure what it is at the moment. I can probably fill it in post exactly what this is. But we will have to cut this biceps femoris cranialis off, which will take that lovely vein with it, sadly. So I'm gonna do that, and then we'll get back with you. Actually, let's just do that right there. Okay, so it is cut. Now we have better access to that region behind the knee, and we can see some branching right up in there. There's a nerve here that we want to keep intact, although if you break it on this side, we have it on the other side, so it's totally okay. If it does snap, you can see our plantaris. That's nice. That posterior tibial artery and vein, and then we go back up here, and we gotta dig quite deep to find where that split occurs. So I'm gonna dig this out a bit so we can see some branching. I just have to remember. So one thing I will do is I know where it is on this side. Okay, so I'm just gonna stick my probe through that muscle and verify that is where it's coming out. Okay, that is where it is coming out. We can see my probe right here. So then this is the the popliteal artery and vein, and then our anterior tibial artery and vein are branching off in this direction. Let me just get a probe under that. Now, I don't know that we'd expect you to dig them completely out. I do not think we will. This should be good enough, but if that changes, I will change it in the video and we'll tell you in class. So this is the anterior tibial artery and vein. Sort of hard to get to, but it is, you can see it. So that is a nice one to see. Popliteal artery and vein and the posterior tibial artery and vein. Try to keep those nerves intact if possible. We will be doing some nerve dissection, but not a whole lot, unfortunately, because of time constraints this year. What we'll want to do is actually fully detach that biceps femoris caudalis. There's going to be an artery and vein that feed it and drain it, so I'm trying to keep those intact as much as possible, but it's okay if they pop because, well, frankly, they're not ones we want to learn. But, well, I mean, I do want to learn them, but they're not ones that are essential for your exam. So the popliteal artery and vein is actually right here. I had to dig a bit deeper for it. And then that anterior tibial artery and vein are going to be right branching that direction. For our purposes, this is anterior tibial artery and vein. So yeah, just keep those in mind. There's some additional branching again to that biceps femoris caudalis and to the biceps femoris, to the vastus muscles, so that, you know, there's branching that goes to all the muscles, of course, because they all need blood and need to be drained of blood, but we only want to focus on the major branches that are more difficult to break. So again, just so you can see that a little more clearly in this one. That is basically the lower circ dissection. We have the abdominal cavity and the leg. It's a lot of picking fascia and digging through some muscles in the leg and cutting through that abdominal wall to get those arteries and veins exposed. Remember to avoid things like the ureters, so keep those intact. Clean up, fat and fascia around the arteries and veins. Being mindful of the reproductive system. Just, you can get a little bit of hands-on experience with it, just seeing it in this dissection, but we're not going to get to the urogenital dissection, unfortunately. Later on in the semester, although it is something everyone looks forward to. So, anyway, yeah, I could pick at this all day. In fact, I will keep cleaning it up a bit. But that is the majority of the dissection. So thanks for listening, everyone. Take care. If you have questions again, just let us know. Bye now.